I'm Professor Dr. Somashekhar. I'm the chairman of oncology of the Manipal Health Enterprise Limited, and I'm also professor and head of department Surgical Oncology in Manipal Cancer Center at Bangalore. If you see that this unfortunate scenario in oncology is most of the time the patients are afraid of the treatment more than the disease. If you just ask them, they just think that the treatment has so much side effect. They're afraid that probably the treatment is more problematic than the disease per se. So these things totally has changed now. We have introduced a minimal comprehensive nature, minimal access in the oncology. No longer the treatment is more dangerous, number one. Now this is an era of organ preservation protocol for us. So there is a lot of advancement in surgical field of oncosurgery, like we have used minimal invasive, robotics. So at one time we target the early cancers where we not only have a high chance of cure, you retain the organ, we quickly see that they go back to their work with minimal invasive component and maintain excellent quality. If you see the other spectrum, which is more applicable to a country like ours, people come in advanced cancers where it is thought they can never be cured. There you have a advanced technique like targeted therapies, very advanced immunotherapies, genomic based treatment, or it is HIPEC where advanced cancers can be cured. So we cover the both spectrum. So these are two ways. A lot of things have changed in oncosurgery which was not there before. If you see that there are a lot of cancers like stomach cancer, colonic cancers, the ovarian cancer, we call them under a group called as peritoneal surface cancers. They always come in stage 4, very advanced when it has spread. Not far away, there was no cure ever for them. The average had a lifespan of 3 to 6 months, they used to suffer a lot. A new modality of treatment has come which we call as HIPEC, Hyperthermic Intraperitoneal Chemotherapy, where at the time of surgery for these cancers I enlisted which have spread stage 4 where cure is not possible, at the end of surgery we put this special US FDA approved machine or a pump where there is a current of 42-degree temperature fluid with chemo which pumps in the tummy and then clears off the cancer. So this needs a special dedicated unit and a team which we have taken in last 3-4 years, which has given lot of ray of hope to this peritoneal surface stage 4 advanced cancer which otherwise never had a chance of cure, where it has given a lot of hopes which we use them. If you remember, cancer surgeries are very big surgeries, large magnitude, take typically 6 to 11 hours. Like if you take a foot pipe cancer, we would do it in the chest, we do in the tummy, we do in the neck. The surgery would go on for 11 hours, patient would have cuts everywhere, they would be in ICU on a ventilator, a lot of pain, they stay in hospital for weeks together, the rehabilitation would be very tough and they would be on ventilator, then they go back and it would be 3 months by the time they go back. But it was required for cancer surgeries because it is a high magnitude surgery. Not many before the laparoscopy ever was able to be used in cancer. Now we have a robotics. It is a very advanced machine which has been set up by the NASA, the Stanford and the Washington DC equipments, where we do small keyholes like 5mm, 8mm. This robot has got 4 arms which is totally under disposal of surgeon. We wear the joystick and we use all the 4 arms. The camera magnifies the cancer and non-cancer spot 12 times with a 3-dimensional stereoscopic. There is multitasking, there is a laser, there is a harmonic. So now imagine like surgeon has all this at his disposal. We use this 4-arm technique, stereoscopic, magnified view, and through the keyhole we go and perform the same complex cancer surgery with minimal to no blood loss which doesn't need blood transfusion. Patient just walks above evening, has a normal meal in couple of days or 2 to 3 days in some case of colonic cancer, rectal cancer or gynec cancer, they just go home next day. So you have a precision with minimal invasive, no pain, no blood transfusion, excellent quality of life with outcome phenomenal. This robot has totally revolutionized. Like we at Manipal last 5 years have done over thousands of cancer surgery through robot. So no longer the treatment and surgery is more problematic than cancer. Now if you see in cancers, it is not just removing the primary cancer. For example, you take a skin cancer, melanoma, or you take a breast cancer. In cancer, there is 2 components of surgery. Removing the source where the cancer started. We have something called as lymph nodes in the armpit, in the neck or in the tummy where cancer goes. There is no way humanly possible or even the best PET scan which can accurately say cancer has gone to lymph node. So we blindly go and remove all these lymph nodes. What happens? If all the lymph nodes come negative, cancer are not spread, that patient never have any benefit of the surgery. On the contrary, They have all the complication, morbidity which they carry lifelong, which will limit their day to day. For example, they'll have a lymphedema, swelling of the hand, shoulder mobility problem, which is lifelong debilitating. They're cured of cancer, but they suffer with the complication. So now sentinel lymph node biopsy is a technique where we use a special blue dye and we have a small pen-like handled gamma probe. We give a small medicine, that gamma probe is navigated and we do this frozen section biopsy which says lymph node is involved or not. In 75% of the time it is not involved, so we don't have to remove those nodes and give the complication. So sentinel lymph node biopsy is a technique, minimal invasive, which lets the surgeon who is treating cancer at the time of surgery to know whether cancer has spread to lymph node, do you need to remove? If it is not spread, you don't have to give the morbidity. Excellent quality of life, great precision, beautiful, pain-free life for the patient. So this is called sentinel lymph node biopsy. Now it is like level 1 evidence. We say it is crime in an early breast cancer not to offer sentinel node biopsy technique to a patient. So it is used in many cancers, breast cancers and melanoma extensively used. As we know, in India, the commonest cancer is breast cancer. It has overtaken cervical cancer and they are cured for life and most of them have normal life. We don't want them to be cured but have the morbidity. We, right from the day we inspected, we went to a comprehensive nature, which means the cancer surgeon, the medical oncologist, the radiation oncologist, the nuclear medicine, intervention radiologist, pathologist, and then our pain and palliation, all are available at one given moment under one roof. If you see a dedicated cancer center, our patients are complex disease, lot of morbidity they have. You need all other allied specialty, intervention, gastro, nephro, cardio, everybody under one roof. So our USP is, we are not only comprehensive at one part in cancer center, all other allied specialties like the pulmonology, the nephrology, cardiology, everybody is available at one sitting in one hospital. And we have set up a multidisciplinary tumor board where we use everybody's view and take a decision. So we gave a thirst on quality at beginning. We decided what is available in best in Western world, US, UK should be available. So we were among first pioneers to start sentinel node way back in 2000. We are the first to introduce the robotics and starting the oncosurgery in robotics. We were pioneers in sentinel lymph node. We are the people who have the largest number and who offer HIPEC for our patients. So we concentrate on high-end quality treatment to all the patients. Like atrium spears or SIR spears, we are the only guys who offer to an advanced liver cancer non-curable. International atomic researchers identified only our center to use that. So we have a therapy center, comprehensive nature in all the fields of oncology under one roof and the best quality. Like we are pioneers in robotic oncosurgery, sentinel lymph node, hyperthermic intraperitoneal chemotherapy. So everything under reconstruction, microvascular anatomy, microvascular reconstruction, everything is available at a very affordable cost at one roof for us. No other field in the world, no other medical field has so much of research which is translated. If you see that every day there is research happening in every field, you say pediatrics, you have cardiology. But if you see the end of the light, they say light at the end of the tunnel, 1,000 research, one may come in 5 years. But not so in oncology. Now the treatment has moved from traditional treatment to totally genomics. Now we do a small biopsy of cancer, the cancer cell genome is analyzed, every mutation is studied, the treatment is totally based on that now. So the research is happening and translating very fast. You leave 2 months, already the research has come back. Old time we used to say, the treatment was traditionally surgery, chemo, radiation, which a lot of side effects. Now the treatment is totally based on immunotherapy, targeted therapies. It is not carpet bombing, but a precision missile attack. So now all the targeted therapies are moved on. Now we study and treat at the genetic level of each cancer, very, very precise, and then we have all targeted therapies. So I would see in future, probably you take one cancer cell, do a genomic mapping, see what is the problem, for this cancer, this patient, this particular immunity mediated therapy will control the cancer. No longer you would need a major surgeries, major chemo and side effect. This is moving in that field. Lot of cancer that has already happened. I would aim it's actually our oncology field to reach there. Yes. And then unwanted lot of treatment will be cut off.